So let's take a few minutes and talk about evaluation. This is going to be a brief introduction to evaluation as the rest of the semester focuses on it, but I want you to have a good basic understanding of the concept before we move forward. The topics covered will be evaluation, the role of evaluation, the types of evaluation, and stakeholders. This is the formal definition of evaluation. This is a somewhat complicated definition, and it is based primarily on this evaluation framework that is used by the US CDC. This evaluation framework has been revised several times, but the basic concept remains. One thing that you will notice about it is that the evaluation framework is a circle. So this means that evaluation should be continuous. While you may go through one formal evaluation process, the idea that you are constantly looking at your program and assessing whether it is meeting your goals and objectives should happen throughout the lifetime of a program. Some keywords that you're going to want to pick out from this formal definition are systematic method, collecting, analyzing, and using data. Evaluation should be planned out in advance. It doesn't work well if you go in and decide one day, hey, let's perform an evaluation. You're not going to come up with any usable information. In order to come up with that usable information, you need a plan. You need to decide how you're going to collect it and what you're going to do with the data once you have it. So that's the analysis portion. And then finally, what are you going to do with the data once the analysis is done? What is the so what? You now know how the program did. What are you going to do with it moving forward? This is another slightly simplified version of that definition. Evaluation helps us determine value and worth of a health program. So what does that mean? It means you are going to decide if the program is meeting your needs, if it's providing any value. There are times when health programs don't have as much value as they should. And often that's because evaluation is not taking place. Another issue with evaluation is when we collect all this data but we don't do anything with it. When we don't, it's very hard to prove the value and worth of a program. And it's also very hard to prove the value and worth of actually going through that evaluation process. So an evaluation needs to be based on predetermined criteria identified by the stakeholders. So what does that mean? It means that you need to have an idea of what you are evaluating before the evaluation begins. It's not one of those things that you can go into and kind of just fumble your way around, see what happens. That's some of what we do in qualitative data. It's a little bit exploratory. Evaluation is not exploratory. You need to have a predetermined set of criteria prior to going in. Now let's talk about the stakeholders piece. In a lot of cases, the stakeholders are going to be the people who are actually funding your program or components of the program. If you hope for them to continue doing that, you are going to need to evaluate the program based on criteria that they set forth. Stakeholders don't just fund programs, but they're also anyone that has a vested interest in the program or the outcomes in the program. So your evaluation needs to align with those outcomes and the values of your stakeholders. You're going to have a really hard time using evaluation to prove a point if you haven't asked the stakeholders what point they want you to prove. Let's do one more definition of evaluation. This one is where we simplify it to its most basic form. Evaluation is how we understand if our program did what it was supposed to do. Now, there's many forms of evaluation that you can do to determine whether the program did what it was supposed to do or if specific aspects of the program did what they were supposed to do, but essentially, evaluation tells us, did our program do what it was supposed to do? And in some cases, how well did it do what it was supposed to do? Let's talk about the role of evaluation. Evaluation helps assess and improve quality and determine effectiveness. So this goes to that piece of how well did the program do what we anticipated it doing? Did Are the outcomes quality? Are they lasting? Is it effective? So when we put a specific intervention in place, do we get the results that we would suspect or expect? Programs are evaluated to gather information. Sometimes it's used to gather information to justify continuing the program. Sometimes it's used to gather information so that future programs can build off of the good and the bad of your program. And evaluation is used to make informed decisions. In public health, our funding is very limited. So we need to decide, are we getting the biggest bang for our buck, essentially? Are we getting value from this program? And if so, what should we do moving forward? Think of evaluation as something that you do, so you gather information to take the next step. Evaluation, like I said, helps public health get the biggest bang for our buck and use our limited resources. It also helps keep us on track. Are we doing what we meant to do? Think about a time when you've been involved with a project and you've started to go off on a tangent. This is really easy in public health and really any program. You start to go down these tangents and you realize, oh, this is in no way what I meant to do. So evaluation helps you rein it in. It creates those criteria so that every step along the way, you are making sure that your program aligns with the original goals and objectives. It also is an opportunity to keep stakeholders informed. Sometimes evaluations will have formal check-ins or some sort of formal deliverable associated with them that will be presented to the stakeholders at set milestones along the way. So what happens when public health doesn't evaluate? Well, unfortunately, public health often fails to evaluate, or it fails to evaluate programs correctly. And the biggest reason for that is a lack of funding and a lack of understanding about how to evaluate a program on the part of the public health worker. So when public health doesn't evaluate, sometimes our programs don't meet their intended purpose. Sometimes they start to meander and address a different issue. Sometimes our resources are wasted. And like I've said a number of times, our resources in public health are limited. When that starts to happen, the community can lose faith in public health. Some problems may be overlooked, and best practices or evidence-based methods may be pushed aside in favor of the status quo. And by the status quo, I mean the way things have always been done. If you've ever worked with an organization, whether it be in an employment setting, a volunteer setting, in your neighborhood, or even sometimes in your ward, occasionally you will come across the phrase, but that's how we've always done it. So if we fail to evaluate, we don't know if the way that we've always done it is the best way to do it. We just know that that's the way we've always done it, and that's the path of least resistance. That rarely turns out well. So we evaluate so that isn't our fallback. Okay, but we don't use evaluation in our daily lives, right? Wrong! You all talked about this in your icebreaker. We do use evaluation in our daily lives. We use it to assess grades in school. We use it to assess whether or not we are taking the correct route to a location. And when we get to that location, we make some sort of judgment call about whether or not we want to take that route back, if it met our needs. We also do it anytime we buy a product where reviews are available. I don't know about you, but I buy quite a few things off Amazon. And when I do that, I try and buy things that have a high rating. I understand there are some flaws with customer ratings and reviews, but if I am buying a product that has 10,000 reviews and it has 4.5 stars, I think the product may be better than another product that maybe has 10,000 reviews and 1 star. I mean, we're looking at crowdsourcing. There could be flaws in that, but it's a good way to gauge whether or not something is going to meet our needs. So now that we've talked about evaluation basically, let's talk about the different types of evaluation. There are many types of evaluation, but most of them can be boiled down into these 4 basic categories of formative, process, summative, and impact/outcome evaluations. So let's talk about formative evaluation for a second. When I think of formative evaluation, the way I remember it is the formative years. If you've listened to any conference talk, they often talk about the formative years being childhood. So I think of formative evaluation as an evaluation that takes place early in the life cycle of a program. This can be before a full-scale rollout happens. It's often part of a pilot test. Formative evaluation looks at whether or not the program is going to meet the intended purpose. It is important to do early on if you have the opportunity to do formative evaluation. So before you spend all of your money, time, and resources, you know whether or not your goals and objectives are going to be addressed. So if I was rolling out a program that looked at implementing some sort of mobile health app to check in with expecting mothers, I might, and I wanted to use formative evaluation to evaluate the success of the program, I might choose to pilot my program with 100 mothers in one very small area. So I might roll out my program to 100 mothers instead of statewide or countrywide. I could take them through the entire process of implementation and actually using that particular app, and then come to the end and find out what their thoughts were on that experience. Now, here's the key to formative evaluation. Formative evaluation requires that you take that information and you put it into action. So I know the opinion of the people who were in my pilot test. What am I going to do with that information to improve this experience for future users? Remember that. Formative evaluation requires some sort of future action. You're not just saying, the program did this, this is the result. Okay, the program did this, this is the result, but what am I going to do to improve the program? It can kind of be thought of as a rough draft in a sense. If you were to turn a rough draft into a professor, they would have the expectation that once they gave you feedback, you would take that feedback and improve on your final draft. You wouldn't just leave it as is. So process evaluation can also be thought of as a formative evaluation, or a type of formative evaluation. And the reason for that is process evaluation looks simply at the implementation process. Was it done correctly? Was the program implemented according to all the process steps listed in the implementation plan? If it wasn't, why wasn't it? What things need to be adjusted so the program follows that exact procedure? This is done so you can assess whether or not the procedure meets the needs of the particular program. So, for example, if you were working for a hospital system and you were part of a new electronic medical record rollout, you would need to follow a very specific set of steps in order to implement that new EMR. If you are a part of a hospital system, for example, that is implementing Epic, which is a very big EMR system that is commonly used in the United States, there are various versions of Epic that are implemented. It's a little bit of an a la carte situation, which has a number of issues. But in order for Epic to be truly implemented in your workplace, you need to make sure that each department follows the exact same protocol for implementation. If they choose not to do that, it will not work. So process evaluation looks at, did we follow the process? If we followed the process and something happened where things didn't work out how we expected, why? Or if we didn't follow the process, why did we choose to deviate from the process? This usually occurs right after implementation, but before the program rolls out on a large scale. So back to our Epic implementation, you might be looking at how is Epic implemented in, for example, the cardiology lab. Was it implemented according to the procedure set forth? If not, what do we need to do to adjust it before we roll it out to another department within the hospital, like labor and delivery? You're trying to make the process smoother. You would use formative evaluation or some of these other evaluation concepts we're going to talk about to make sure that you're reaching your desired outcomes, but you need to make sure that the process is followed correctly. Summative evaluation I think of as the summary. This occurs at the end of the program, and you're really looking at, did the program meet the goals and objectives set forth? This is the summation, so it doesn't require that you take any steps to go back and revise and improve the program for the future. It's just done. It's assessing the program effectiveness. Now, summative evaluation can be broken up into two different types, and these are impact and outcome evaluation that look at the long-term effects of the program at different points in time. So impact evaluation is longer term. It's 6 or more months after the program concludes, whereas outcome evaluation tends to be shorter, and that's 0 to 3 months after, or 0 to 6 months after the program concludes. You are looking at not only did the program immediately meet the goals and objectives we set forth, but did it meet those goals and objectives and continue down that trajectory for an extended period of time? It focuses on those long-term effects that your program has on changing behavior, attitudes, or awareness. In most cases, we want our programs to last a little bit longer than 0 to 6 months. So we want to make sure that what we are doing has a lasting effect. This table includes all of that information we talked about, but in a side-by-side format. Let's talk about stakeholders. Stakeholders are anyone who has a vested interest in your program. This can also include funders, but it also can include community members. So for example, if you were working on a program to improve maternal health in your community, maternal health outcomes are something that impacts the entire community. So you might look at religious groups, you would look at healthcare providers and healthcare centers, you would look at public health, you would look at whoever is funding your program, but there might also be some areas that you might not normally think of. There might be some sort of food or nutrition program where you would want to get their input and buy-in, some sort of education program, especially in those maternal health outcomes, because many mothers have children who are enrolled in school, and if there are poor maternal health outcomes, then maybe it impacts the kids' education down the line. You need to take the full look at who are your potential stakeholders. In many cases, you will gather them together and ask them, or in some way pull information from them about what their expectations and needs are. But essentially, all stakeholders want to understand the scope of the project. So what are you doing? What extent are you extending this information to? And they want to improve the implementation in the future. So they want to make sure that if this project continues in perpetuity, or if this project is rolled out to a larger group, what do we need to do to improve that implementation? They want to know what public health is doing with the resources provided, whether it be monetary, space, staffing, any resources provided, and if those steps are working. As you go through public health, whether you're going through program planning or research methods or evaluation, you always need to consider who are my stakeholders and what are they requiring of me. So that's our very basic overview on evaluation. We'll get more into the different evaluation techniques and methods going forward, but now you have an idea. We have really 4 basic types of evaluation. We have formative evaluation and process evaluation, both of which take place early on in a program's life cycle and require further action so the program can improve going forward. We also have summative and impact/outcome evaluation, which looks at what is the end result of implementing this program or intervention in our community. And we want to remember stakeholders. We need to keep them in mind as we are determining our evaluation criteria. Evaluation helps us determine if our program is doing what it is supposed to do. So there you go, a quick overview on evaluation.